Hello and welcome once again to another episode of From the Heart. As always, the show is brought to you by your American Heart Association and by the West Virginia Library Commission. I'm your host, Kevin Pauley, Marketing Communications Director for the American Heart Association. Well, community impact is something that impacts us all in the grand scheme of things. And even with an organization as the American Heart Association, the name would imply a national organization, we do so much work on the ground community level, and that is some of the most important work that we can do to actually help move the needle of public health will happen. It's that grassroots, there in the community, of the people, by the people, for the people kind of work that really is getting results. And in an area like West Virginia and the Appalachian Belt, this work is critical. And here today to talk more about what we are doing in this field is our Community Impact Director, Holly Mitchell. Holly, welcome back to the show. And again, like the work that you are doing out there, I mean, like it is truly, you are really out there with the people in these communities. Yeah. So talk a little bit about the philosophy of our community impact work, especially in a region like the Appalachian region.
Yeah. Well, a lot of the things that we have to look at is the reach that we have. How many folks that we're going to benefit from a program that we implement. So sometimes we look, by region, by county, by town, population. We do a community health assessment to see exactly where their needs are, from the statistics. And word of mouth. We have wonderful clinical partners that are throughout West Virginia, and we ask them, hey, what can we do to help? And a lot of times it's that conversation, here's what we have, here are some programs that we can develop. Target BP with the clinical folks, nutrition with some of our community pantries throughout West Virginia.
Right.
So we kind of, what do you have and what would we have that can align to have that need, met?
Well, I think it's important, as you said, you're talking to them because they are out there in the community. They know what the issues are, they know what needs are being faced, and they know what things that they need to do to help make improvements. So where those programs that the Heart Association brings in can make an impact, that's what it's all about. You have been in this now for a couple of years, which, it's amazing that time has flown by. For you, when you think about the work in community impact, like what are some of the things that stand out to you that you've seen, happening here in West Virginia?
A lot of what we see, we have heroes all over West Virginia.
Indeed.
And they are folks who work at these clinical sites, are community leaders, and they always are thinking about others. Selflessness, they're thinking about other things that they can kind of tie together. And when we come along, to offer what we have too, that's just another kind of, I guess, in the quilt that they're making for care is a little piece of us that goes in that. And I like that too, that we can, it's not just, oh, here's the Heart Association, blood pressure cuffs, and we go bye-bye. We are there, and sometimes they call us going, hey, we have this project. Maybe you guys can help us out. And even just, past week I was talking to a farmer's market director, and just to hash out some ideas, if I didn't do anything else, at least I was a sounding board for them and some of the things that we can kind of do together to link things up. And that's what's so great to me is that they look at us as a community leader too, and a resource for the need.
Well, and I think a big part of it is, again, that we do have, we are there. Like it's not just, here's a bunch of stuff, see you later, call us when you need more or whatever. Yep. There really is that active partnership. Yes. And I think it's that partnership that really makes the difference, because it's one thing to, say, hey, here's a website, go pick out some programs and go use them. But a lot of times, there's a lot going on in these programs, and to have someone who can be there to help and who can actually help them implement it and help them look at the data and help them kind of figure out like, where do we go to next? That's a really important part of this. And I think it's important that we have that going on. I know you are, burning the candle at both ends sometimes, but the results are definitely there.
Yep.
In the time that you've been here, what are some of the the wins that you've seen, in the region that you cover?
A lot of the wins, meeting people where they're at and piggybacking on existing programs to kind of activate more engagement. That's a big thing that I've noticed. Whether it's the pantries, linking up with the Mountaineer Food Bank. We had refrigerators for school pantries, which is a huge win, because it's not just some of the snacks that were really great or whatever. Now they have options of fresh food
Yes.
and vegetables and fruit and things like that. And kids, you know, if it's there, they'll eat it and they'll.
Well, and that's something we kind of take for granted too. You would just think that that would be there in any
Yeah.
school, and it absolutely is not the case. So that was a really great one there, because that was also your alma mater,
Yep.
if memory serves. It was East Bank, correct?
Yes, I'm very proud of that because it's like that's the community I came from, full circle, helping out, which makes me feel so great. But I love seeing that all over the state. I mean,
Yes.
we've done that, dental programs that we've linked with. They do blood pressure screenings on their patients now, and we've had countless stories of folks that didn't know they had high blood pressure. They see their dentist, you know, for a cleaning, and they go in, oh my gosh, my blood pressure is really high. And then they go to their doctor and they get on some medication, potentially saving their lives.
Yes.
So that's a big win for us too. We love that. And there's other community programs too, like our Healthy Sundays, taken off so great. I love it. Our community churches are becoming a really a resource for folks.
Yeah.
You know, not just being healthy, you know, spiritual wise, but also, you know, with their body and mind, and offering them a blood pressure program. I love it because it's right after a service. They get their blood pressure taken. They can monitor that for like 6 months. And we've had countless stories of successes with that too. And that's all over West Virginia. We love to have other churches to sign up. We're in North, we're in the South, we're in the East.
Yeah.
We're going over to the West now, having some of the other churches. So we're very proud of that.
Well, I think that's the great thing about that kind of a program is, again, we know that especially in Appalachia, you know, churches are more than just a church. They're a community hub. That's where people come together. It's where they congregate. And it's not just congregating on Sundays.
Right.
There are various things going on throughout the week. And when you can work with that entity, you know, to really help get blood pressure cuffs on people's arms, to get people talking about,
Yep.
you know, their health, you know, as you said, not just spiritual health, but your physical health.
Yep.
That is a massive needle mover right there. I mean, it really, really is.
Yep.
You know, with that in mind, we have a video program that we're going to show you now. The American Heart Association worked with various rural communities, including West Virginia, to put together a series called Health Wanted, looking at the impact of heart health in rural communities. A lot of times, our rural communities, as many of us know here in West Virginia, you don't always have access to fresh fruits and vegetables. You don't always have access to health care. So this video series is looking at and addressing those issues. So what we're going to show you today is the one that was put together especially for West Virginia. So take a look now at Health Matters.
I was one of those people that thought nothing could happen to me, even though I found out I was a diabetic, I'm thinking 30 years ago. And I understand the problems that diabetes cause. And I'm thinking, that won't happen. That won't happen to me. And yet, I had a stroke, had a heart attack, had a kidney transplant. But, you know, that won't happen to me, even though it happened to me.
It's just a close-knit community. There's a lot of family. My mother had 16 siblings. When my grandmother passed away several years ago, we started counting the grandchildren, and there were over 100 grandchildren and great-grandchildren.
Those are the apples I eat.
Which are the better apples, though? The big old apple tree, right?
Yeah.
Yeah.
It's big families, so everybody's kind of related, close-knit. So it's important, I think, from that aspect that we all do take care of ourselves, and we do feel like we are taking care of family because most of them are family to us. There's one grocery store in Raynell. There's not a lot of places for people to exercise. Transportation's an issue for people. It's an aging population there. For them to try to drive somewhere else, they just can't get somewhere else, and gas prices going up, that makes it even more difficult.
Well, a lot of times, people don't come to the doctor unless there's something actually wrong with them. And then they have transportation issues, insurance issues. We are a small rural community, so you've got to see what's available to you and your needs. As far as the education and phone calls that we're doing right now, they would they would have to call the office and wait for a call back. If they were having a problem, they would probably have to wait 3 months till they got another visit.
When the insurance kicked in, I had already had an appointment set up with the wellness center. So I go down and they do the full workup on me, all, checking for everything. Well, a couple days later, found out that my blood sugar was up in the 600s and my A1C was, I think, like 14 or 16.2, and my blood pressure was whoop, way up. I can't remember exactly, but it was way up. They got me started that day on taking care of the diabetes. They sent me over to see the ladies in the wellness center for the diabetic group. I was doing everything that I could, like walking 2 or 3 miles a day, working in the community garden as volunteer, which I love doing that, but it also helps the community a lot and also helps feed a lot of the people in the low-income building there right across from the garden.
The Williamson Health and Wellness Center, they make sure I keep my doctor's appointments. I take my medication.
I'm trying.
Melissa calls to make sure my blood pressure is doing fine. And if it isn't, I think she's in touch with the transplant clinic in Charleston, and they talk about what I need to do. They got me trying to eat healthier. My A1C was 11.6, 11.8, it was somewhere up there. That means I could have another stroke, heart attack, or die. So, with my condition, so they got it down in the 3-month time period.
I think we have been brought up years here in West Virginia that we eat foods that probably aren't the best for us, and so learning to redesign our diets to where maybe we take out some of those fried foods and the biscuits and gravy that we were brought up on, because I want to live a long life. I want to be here to watch my grandchildren, because I can't imagine a day that I couldn't see them graduate high school. I want to be that great-great-grandmother.
The green parts are green beans.
We have a significant history of heart disease in our family. 2 weeks ago, when my sister almost had the heart attack, that frightened me, that she may not be here tomorrow. To me, it was important to start making life changes. We've lost about 30 pounds, still have a lot to lose, but making those changes.
Like when it rains, it's good with rain.
The raindrops are good on it? Yeah?
It helps it grow better.
We have to pass it down to them. We have to change it somewhere. It's emotional. It is emotional when you see people you love dying from this disease. And that we could change it. There's a lot we can do to change it.
But I don't like broccoli.
I don't like broccoli. One step at a time, one small step at a time.
Actually, when they first started educating me, they would have cooking classes. They were showing me how to make stuff in a better way. So it helped. Believe it or not, I can eat cauliflower now.
I love eating the stuff we grow in the garden. Tomatoes, cucumbers, broccoli, cauliflower, Brussels sprouts, onions, lettuce. Did I mention tomatoes? Zucchini and yellow crookneck squash and potatoes. But we still have all the other stuff going too. It's just now starting to come in good. I'm able to enjoy what is here a lot more now thanks to the Wellness Center and my doctors and the girls in the group. Look, you know, if you have a heart problem or diabetic or something like that, you need to go get in one of the groups at the Wellness Center. I had help getting healthy, and it came from them, and it's available to you. All you got to do is go talk to them.
Once they get to know us and see that we're really not there to judge them, we're there to help them. I'm not trying to boss them around. I just want to give them some education. The farmers market gives them some healthy choices for their chronic conditions. You know, if they got heart disease, that would be better choices for them besides a bag of candy.
Blood pressure's down. I'm almost a vegetarian now.
I'm trying. I know it doesn't happen overnight. I have 2 kids, and I tell my boys, you got to lose 1 pound before you can lose 2. So I'm trying. Don't be stupid. Just do what you're supposed to do, and live healthy. I tell everybody, I'm lucky to be alive.
I don't think that I could have done what I did without them. And that includes with them helping me with things to eat, how to address things just to keep your motivation up and trying. And then plus, they're all just like my little sisters or something to me. So it's a lot of moral support, technical support, and plus keeping me involved, so I feel like they're angels in my book.
A lot of it's preventable. Not all of it. I know genetics plays a role in it. I can't imagine how I have that many aunts and uncles and now a sibling who has had heart disease, and there's not a genetic component involved with this. American Heart Association, I know, does research all the time trying to figure out what some of these linking genetics are. A lot of it is preventable. There's a lot of things we can do from a healthy standpoint to make changes. You can't leap off of the mountain, you know, whether you go down or up it, but you do it a little at a time. And so it's making one small change, even if it's a change every week or every month, but it's making a change.
So there you have it. Now, if you would like to learn more about this particular program, you can find the American Heart Association on YouTube. Look up their Health Wanted series, and you will see videos from other states as well, including Kentucky. So we got local, connection there as well. But it is a fascinating series, and one that definitely sheds a spotlight on the fact that there are these issues that we face in rural America that aren't like what other people are facing. So, Holly, obviously, you were involved in helping get this video created. We worked on this felt like forever until it finally came out. Obviously, we know that there's still work to be done.
Yeah.
So we're in a new fiscal year. Moving forward, where do you go from here? I know you have implemented so many programs, but where do you go from here?
Well, to kind of keep the momentum going with our clinical sites, we want to encourage all of our new clinical partners and even the clinical partners that's been with us to definitely keep Target BP, first and foremost.
That
it's
is
a
a critical
priority.
program.
Yeah, they update a lot of the resources. It's all evidence-based. It talks about best practices regarding, taking blood pressures and staff training. So we definitely want that out there. We love it. In the fall, we're going to be recognizing a lot of our clinics that have done really great for last year. So we're definitely keeping that momentum, and then expanding Healthy Sundays, like I mentioned. And also, I'm so glad that you recognized how churches are becoming a community hub, because what we're doing with our churches now is asking for having a CERP policy, and that's a cardiac emergency response plan.
Yes, that was a big win from this past year of the legislative session. We actually passed that bill, and it's so wonderful to see companies stepping up and doing this. Now, we've seen companies doing it, but seeing a church do it, that's a fantastic concept.
Yeah, we want more companies come to us. You know how to get a hold of us. We would love to do a CERP policy with you and do CPR training. That's just like a huge win for everybody, because really, we're out in the rural areas. It's very hard to get to places in a timely manner sometimes, although the first responders certainly try, and we get out there. But if you could do, a CERP policy, and to ensure that you're doing CPR right when someone needs it, definitely could save a life.
Yeah, we talk about that all the time. In West Virginia, there are so many areas that, if you call an EMT, it could still take them 30 minutes, 45 minutes, possibly an hour. And if no one is helping with CPR in that time, the outcome's probably not going to be great. So getting churches involved with that, I think that's a great idea, because, to be able to get a church group together and do CPR training, that is, that's a very spiritual thing too, because what does CPR do but save a life?
Exactly.
And that's an important thing, I think, for all of us to know. I always say everybody should know CPR. Anybody can learn it, because it's like that saying, I'd rather know how to perform CPR and never have to do it than see someone I love drop and not know what I'm doing, because the statistics basically show if you're ever going to perform CPR on someone, odds are it's going to be someone that you know.
Absolutely.
And so I think that's so great to see communities coming together to take that on. But it's not just the healthy churches. You've got so many clinics you're trying to get into. So talk about that as well, because talk about it from the clinical standpoint. What does that look like if they take on some of these programs? What does it involve? How do they do that basically?
Well, we do have an outline to follow, a CERP policy, and a lot of times it's what they're already doing, Kevin.
Sure.
And it's nice that they get recognized for that, and they get a reminder to, oh yeah, we probably should do this every year, or with new staff we should do this, like some annual training. And it's a little bit more extensive, not just an emergency response plan, it's cardiac.
Right.
So it's like, do you have an AED machine? Does your staff know where it is? Do they know how to use it?
Yeah.
And this is hands-only CPR that we're really trying to do. Of course, definitely, if you want to be certified for CPR,
absolutely,
do it. But you don't have to be certified to save a life.
No, you don't.
So we want to, and, some people are kind of like, I don't know about CPR, but you can do hands-only.
Yes, you can.
And that's a lot of, some of the folks that don't want to do it is because they're afraid of the mouth to mouth.
Exactly.
But, we want to show that hands-only definitely is the way to go, save a life, and get that. So a lot of our church partners are doing this, our community partners, some of our wonderful sponsors, we're asking them, consider to have a CERP policy as part of your overall emergency plan. So I'm really excited about having that as an option for, to kind of increase that because of such a need.
Right, and we've even seen some of the companies that we've worked with, our friends at Link, they were able to really take that and run with it. And, we've seen other companies step up to take on these policies. We've seen, of course, that was the big win for our legislative session this year, was that schools that have athletic, events, they have to have a CERP, to make sure that if something were to happen, someone there can help take care of them, which is fantastic. But, we going into this new year, with the work that you're doing, what's sort of your wish list? What are you hoping to see, come to fruition in this next year?
Wow, I would really love to have more dental partners to come on to do just the BP screening. We have a wonderful grant from the Benedum Foundation to increase awareness of hypertension, and one way would be to do blood pressure screenings. So they don't have to be affiliated with an FQHC or a clinic. They can be a standalone. We would provide the cuffs for them and train their staff. They can look on our evidence-based list of resources to learn how to do that, and do all the blood pressure screenings for folks coming in twice a year. So if you're having a cleaning, you're going to probably see your dentist more than you're going to see your regular doctor.
That's very true.
So definitely want to have that. If anything else, if you get screened, you know, and a baseline, it's like, wow, my blood pressure's really increased, you know, from last year. Or just to have that conversation and have some information there to talk to their patients about that. It's going to be a win because they're like, you know what, probably go see my doctor because my blood pressure is crazy. So
Right.
we're definitely, I would love to have that. Love to have more churches. Some of the clinical folks that we haven't got a chance to have a relationship with to do like a self-monitoring blood pressure program, we have a grant to cover that. We would love to give your patients a blood pressure cuff and allow them to do that twice a day, you know, every day, and have a baseline, talk to them about it, talk to their providers, and to see where they're at, because hypertension, we're number 2 in the nation.
Right. And the thing is that where people have used that program, we have seen impressive results.
Yeah.
Like, again, like you said, many people didn't even know they had high blood pressure, and now they know and they can address it. And we've seen so many people like no longer, you know, qualify as hypertensive. They're in a normal range. And all it took was just knowing that they even had it, and someone to talk to about how to make those kinds of changes, and that's massive.
Yep.
You know, any other big things you're hoping for this year?
Probably a more of expansion of the nutrition piece. When we worked with the middle schools with their pantries, we would love to do pantry policies with them and to get them refrigerators if they need it. Some guidance to do bags home to students and see what they need. We work with a wonderful partner. It's the West Virginia SNAP program, and they have a teen cuisine, which they do, and it's so cool because it's on Zoom. Students can come in. They have provided boxes and tools that they can use. And I've been there. It was at East Bank, and I got to witness that. And some of the students, you know, it's really empowering for them to make themselves a healthy snack.
Yeah, absolutely.
So that was, and learning more about why you should have this over this. You know, why is a, you know, fruit and, you know, maybe some pita chips better than Cheetos.
Right.
So it's really neat, and I'd love to expand on that too.
Well, as with anything, Holly, thank you so much for the work that you're doing. You have had so many wonderful wins, and you've made so many meaningful partnerships in our community, and that doesn't happen by accident. That happens because you're out there doing the work. So we are really proud of you, and we thank you for being just an impressive piece of the work that we're doing in the state. You know, community impact is really a thing that we are moving really hard on the national level. It is something that really has been a major focus of the Heart Association these past few years, and especially in a region like Appalachia here in West Virginia, we know just how important that is. So thank you for everything you're doing out there, and I look forward to seeing all the successes you're going to have, and you're going to have tons, I know, in this next year. So thank you again for that time.
Thank you.
Well, that will bring this episode of From the Heart to a close. Now, if you'd like to learn more about what we talked about today, you can contact me by email at kevin.pauley@heart.org. And if you have questions about what Holly's talked about today and how you can be involved, I'll be happy to get you in touch with her. You can also find us on social media on Facebook at AHAWV and on Twitter and Instagram at AHA_WV. Well, we'll talk to you on our next episode, helping keep you informed. On the Library Television Network, I'm Kevin Pauley. Here's wishing you good health and a happy heart.